today's two sessions with Tian. China's efforts, along with a global outreach to be better prepared for an outbreak. The lowdown from CPPCC member Du Bin, who's the Deputy Dean of the Peking Union Medical College Hospital. And the universal appeal of the arts and music, in the words of a Hong Kong artist, Mo Hua Lun, who's also a CPPCC member.
Actions speak louder than words. During China's annual political season this year, I want to take you to meet them, who believe in the greater good and who practice what they preach. Join me two sessions with Tian on World Insight. Hello, I'm Tian and welcome to two sessions with me on World Insight. The government work report this year delivered at the ongoing two sessions touch on efforts made by China over the past 3 years to balance epidemic control with economic development. Amid a post-pandemic recovery, hard lessons have also been learned on how to respond to rapidly spreading outbreaks, along with quickly developing vaccines to protect people's lives from the worst of the pandemic. How can China be better prepared for future outbreaks? What is the focus of China's medical research and development? On these and much more, I talked to Dr. Du Bin, who is a CPPCC member, who's also the Deputy Dean of the Peking Union Medical College Hospital of the Chinese Academy of Medical Sciences. Professor Du, what a pleasure to see you once again.
Me too.
I remember our conversation began in the early days of 2020 when China was struggling against the COVID-19. 3 years already passed. Now, what's your assessment as a doctor on the front line from the very beginning?
My arrival in the Wuhan city, that's in the, I think, in the early January 2020. I think we have a lot of patients at that time, and we have the limited resources. I mean medical resources, including the hospitals opening for the COVID-19 patients, as well as the human power, including nurses and doctors. So we are struggling for every single empty bed to meet the critical patients. I had the opportunity to visit some of the fever clinic at that time, and I did see a lot of patients waiting outside or in the fever clinic to be admitted. So whenever we had an empty bed, either the patient died or the patient discharged or transferred to another, long-term facility, long-term care facility. We will always have another patient waiting for the hospital bed to be admitted. So at that time, we did have a very tough time. We apart from the numbers, the patient surge, we also had very difficulty in managing the patients, especially patients on mechanical ventilation. I do believe that for the first couple of weeks while I was in Wuhan, that it's a period of the collecting data, to know the patients, to know the disease, and to discuss with my colleagues there in Wuhan, although they were from different hospitals or different cities, and we discussed with them about the treatment plans, about their experience with the patients, about their success as well as failures, to figure out what is the best way to treat the patient.
Of course, time went by. I still remember the last conversation I had with you when you were departing from Wuhan. You were sitting in a courtyard, there was sunshine. I remember that so well. And the leaves behind you were flourishing with the green. There seems to be a lot of life coming back in a way, very different from the early days as you described at the very beginning of our conversation. Now, Professor, of course, over the past 3 years, there was ups and downs, to describe it in an abstract way. So how do you see the process we went through in understanding how a pandemic works, in understanding how we can better prepare for future pandemics?
Well, I should say that first of all, we know that the virus will not go away, and they will, come up, pop up, either in one city or in another, and to affect many, human beings, to threatening the patient lives. So, I think we have to learn to live with the virus, not to eliminate. And the second, that we know better. I mean, as time goes by, we know better how to cope with the disease, how to treat the patient with respiratory failure, with the shock, with the renal failure, whatever, organ failures. And we know, for example, that we should put the patient in prone positioning in cases of the respiratory failure. In one patient had to require the oxygen, supplementary oxygen. So we try to, I still remember that in some of the cities that I work, I have to persuade or encourage my patient to be in the prone positioning, in order to improve their oxygenation, in order to feel them, to let them feel more comfortable, and more importantly, to prevent the disease progress, to prevent intubation, to prevent the respiratory failure, of course, to save lives. We had more and more experience in treating the patients, either in terms of drugs and in terms of the non-pharmacological treatments, such as mechanical ventilation, the strategy of mechanical ventilation, the strategy of treating patients with hospital-acquired infections or secondary infections, whatever. So we try to transfer or try to communicate with the local healthcare workers to share with them our experience, our feelings about the patients, our about the disease. Just before the end of last year, for every city I have visited, I've worked in, that we have trained a lot of medical teams to let them to know more about the disease, about the management, about the treatment, the guidance, the national guidance of the clinical management.
You see the discussions about COVID-19 from the very beginning about the disease itself, and then it becomes something about competitions for vaccines and also therapeutical treatment, and then about science, whether science works or not, and then also about politics and even ideologies. So as a professional, as a doctor, how do you see the evolving of discussion regarding COVID-19 in this world?
Here is that even though you have a very effective drugs, like the Paxlovid for the for the SARS-CoV-2 virus, that you cannot guarantee the successful treatment of the patient. You cannot save lives for sure. I have to say that even though you have effective treatment for the patients, you still rely on many other things, such as the supportive treatment, such as the careful monitoring of the patients, the correct diagnosis, the timely action for any accidents or any unexpected complications. So it's a integrated work not only related to effective drugs, not only related to vaccines, what you have. It's a teamwork composed of the different specialties.
And the system, how it works. In this year's annual government work report, there's mention about reform and improve the disease prevention and control system. Now, to you, Professor Du, what are the priorities if that system needs to be improved and further reformed?
My understanding is that there are disparities. There are geographic disparities in terms of the healthcare resources, such as the hospital beds, such as the number of ICUs, the number of the ventilators, whatever, the number of the dialysis machines. But the more important things is that the disparity in terms of the knowledge and skills of the healthcare workers, of the healthcare professionals in different cities, in different provinces. I should say that you know that I am an intensivist, ICU doctor. So I know more about how ICUs looks like, how ICUs work in different cities. I should say that the knowledge and skills show a huge variation. I mean geographically. So my point is that even though we have enough resources like the beds, like the monitors, like the ventilators, we still short of the very good doctors, very good nurses. So how to train the juniors to be a eligible or qualified doctors and nurses is a very tough responsibility, a very tough task for us.
In a way, how to nurture the medical talents, not only in ICU, but also in other parts of the hospitals. I guess that's a very big issue for China.
Well, you're right. The important barrier for juniors to become an ICU doctor is that being an ICU doctor means interruption of the personal life. If the junior doctors they have the feeling of that, they have the sense of the saving patient, they have the feeling of achievement from their daily work, from their clinical practice, to be involved in the in intensive care in this specialty. I think this is a good way to get them involved. Another important issue is that we want to have the seniors in our professional meetings, during our professional meetings, to have the seniors to share with them their experiences, like the narrated medicine, which is more and more popular during these years, to have them to have more empathy for the patients, more passion for the specialty, and more achievements through their daily work. As well, if they were also involved in some of the research, it's clinical research, whenever they discover one important treatment or therapeutic interventions to improve the patient lives, which can be incorporated into daily work, I think they will love this specialty, which is full of a lot of challenges.
So, Professor Du, thank you so much for joining us. Really appreciate it.